the School of Nursing was looking for a clinical redesign.
It's very different than how I was educated or how a lot of nurses were educated.
So it's basically bringing theory in the classroom into a bedside guided by a clinician.
I honestly didn't know what to expect.
This DEU benefits me as a nurse because it really empowers me to share and learn.
I've had moments with students where they finally got something, and it was a great feeling having them have that eureka moment.
The university actually comes in and they train our own nurses to be clinical instructors for the students. The university does have a faculty member on site, but the minute-to-minute education really comes from our bedside nurses. I remember when I first graduated from nursing school, some people embraced having a nursing student. Some people were like, oh my gosh, I already have a full plate and now I have this nurse that I have to try to teach. So my experience as a student motivated me to put the work in to improve things.
We learn how to manage stress, we learn how to talk and communicate and overcome obstacles with the patients, because anything can happen, from a patient being super nice to a code, and you have to react on the spot, and we're being taught to do that.
I have 4 patients assignment with the 2 students with me, all throughout the 12-hour shift. On the first day I met Ryan, I could see that he has a good rapport with the patients.
These are nurses who has enough experience, at least 3 years, working in the hospital. The concept there of developing a CDI is the belief that as an academic person, as a faculty, we might be growing along the way with theory, but there are changes in healthcare. And the changes in practice, those are the nurses that knows what are those changes.
We made a conscious decision not to have any sort of compensation for our CDI nurses. We feel it's a professional responsibility of any nurse to educate. They're doing it because they love doing it.
This is really a rewarding experience to be a part of this.
The nurse who's working with them knows how they progress. So week to week is an evaluation of growth in their learning, in their clinical experience.
When Janelle was a student, the first day of our clinical exposure, she was kind of nervous, but she always had that sense of responsibility and her meticulousness when it comes to her patient.
With the DEU, the nurse had an opportunity to have a 4-to-1 patient ratio rather than a 6-to-1, which allowed a lot of quality time with the students to go over clinical skills, such as inserting like an NG tube or a Foley catheter. I chose to become a CDI because I also love to learn, not only teach other people, but to learn.
That's pretty much the connections that I can make is anything you learn in the classroom, you can actually apply it here. One of my most memorable moments was getting to see an actual code. We stood in the background, but at the same time, the nurses were so helpful that while taking care of the patient, they also explained every step that they were doing. They explained the devices they used. They explained the EKG analysis.
This is the closed circuit feedback mechanism between clinical and academia that gives us immediate feedback on how we design our teaching or how we design our approach with the student, teaching them the theory. And I think that's the beauty of partnership.
We actually just the other day looked at any of the DEU students that we hired here, and of the 54 that we could track, only 2 of them have left our facility in 5 years. It's unmatched in any other program I've heard. We're getting calls from our sister facilities across the country related to the DEU. They've heard about it, they like the model, and they do believe that they can apply the concepts to their own institution.
You know, we want the best for the students. They're going to be your nurse, your family's nurse, and whatever that we can do to help them succeed, I feel like we should, and I think DEU is the best program for that.